Welcome back to Aging Consciously. Today we are talking about something that affects every senior: health insurance. More specifically, Medicare. Many seniors assume Medicare covers everything. It does not. And misunderstanding your health coverage can quietly cost you thousands of dollars a year, delay care, or limit your choices when you need help the most. So today, I am breaking down what Medicare actually covers,
what it does not cover,
the real differences between Medicare Advantage and Medigap, and the costly mistakes seniors make so you do not make them. This is not theory. This is real-life, practical guidance. Let's start with the basics. So, what is Medicare? Medicare is the U.S. federal health insurance program primarily for people 65 or older.
Medicare is also for younger persons with specific disabilities or end-stage renal disease.
Medicare usually starts when you turn 65, with coverage beginning based on when you sign up during your 7-month initial enrollment period, IEP. This period starts 3 months before your 65th birthday and ends 3 months after your 65th birthday. If you sign up in the first 3 months of your IEP, initial enrollment period, then your Medicare coverage will start the month you turn 65. If you sign up in your birth month or the 3 months after, then coverage would start the following month. Signing up late could potentially incur late penalties if you delay Part B without other coverages. Medicare is divided into 4 parts, covering hospital stays, Part A, doctor visits, Part B, and often prescription drugs, Part D, with choices including Original Medicare, A and B, or Private Medicare Advantage, Part C plans.
Part A, which covers inpatient hospital stays, also includes skilled nursing facility care and hospice care, and some home health services.
Most people do not pay a monthly premium for Part A if they worked and paid Medicare taxes for at least 10 years, according to the Centers for Medicare and Medicaid Services, 2024.
Part B, however, requires a monthly premium, and the amount can increase based on income, according to CMS 2024.
Doctor visits, outpatient care,
preventive services, and
durable medical equipment. Here is the first reality check. Medicare Parts A and B only cover about 80% of approved medical costs. You are responsible for the rest. Medicare.gov 2024. This is where many seniors get blindsided. Original Medicare generally does not cover long-term care or custodial care, most dental care, vision exams or glasses, hearing aids, routine foot care. According to the U.S. Department of Health and Human Services, long-term care costs are the largest uncovered health expense for older adults.
As a result, if you need help bathing, dressing, or daily supervision, Medicare does not step in. This gap in coverage is where financial stress begins for many families. Now let's talk about the 2 other paths most seniors may choose. One replaces Medicare, and the other is a supplement to their Medicare policies. These are Medicare Advantage, Part C, and Medigap. Medicare Advantage, Part C, is an alternative to Original Medicare. These plans are offered by private companies and often include drug coverage and networks. These private insurance companies are approved by Medicare. Their policies often include
hospital and medical coverage, prescription drug coverage, sometimes dental, vision, and hearing.
But here is the trade-off. There is
limited provider networks,
prior authorizations required from your primary care doctor before you see a specialist.
Services can change yearly.
According to Kaiser Family Foundation, nearly half of Medicare beneficiaries are now enrolled in Medicare Advantage plans.
These plans can work well, but only if you understand the restrictions.
Medigap, on the other hand, is a supplement to your Original Medicare and only covers deductibles and co-payments.
Medigap policies help cover co-payments,
co-insurance,
deductibles. They work with Original Medicare, not instead of it. Important rule:
if you want Medigap, The best time to enroll is during your Medigap open enrollment period, when you cannot be denied or charged more due to health conditions, per Medicare.gov 2024. Medigap enrollment period is a 6-month window, starting the month you turn 65 and first have Medicare Part B. This is where you have a guaranteed right to buy any Medigap policy without medical underwriting. This ensures you get the best choices and prices. Miss that 6-month window, and insurers can deny coverage or charge significantly more. In this case, though, some states offer extra protections. Missing this Medigap enrollment window is one of the most expensive mistakes seniors make.
Prescription costs can quietly destroy a retirement budget. Medicare Part D helps cover prescription drugs, but coverage varies by plan.
The Inflation Reduction Act of 2022 introduced major changes. They are a $2,000 annual cap on out-of-pocket prescription drug costs beginning in 2025, limits on insulin costs, and expanded vaccine coverage. These changes are expected to significantly reduce costs for seniors on fixed incomes per U.S. Congress 2022 and CMS 2024. This is progress, but only if you are enrolled in the right plan. Here are a few key mistakes to avoid.
Assuming Medicare covers long-term care. Choosing plans based only on monthly premiums.
Missing enrollment deadlines. And
Not reviewing plans annually, even when health needs change. According to the National Council on Aging, many seniors overpay or underutilize benefits simply because they do not review their coverage each year. Knowledge here equals freedom. Health insurance decisions shape how you live, not just how you pay. Aging consciously means asking questions,
reviewing your coverages annually.
Planning ahead before a crisis forces decisions. If this video helped you, share it with someone who needs clarity, not confusion. And remember, you worked hard for your independence. Make sure your health coverage protects it.